Welcome to our YouTube channel Medical Subjects Made Easy. Today's subject is community medicine. Today's topic is dengue fever. 1. What is the primary mode of transmission for dengue fever? The primary mode of transmission for dengue fever is through the bite of infected Aedes mosquitoes. 2. What are the common clinical features of dengue? Common clinical features of dengue include high fever, severe headache, joint and muscle pain, rash, and mild bleeding. 3. How is dengue diagnosed in the laboratory? Dengue can be diagnosed in the laboratory through serological tests, including the detection of dengue-specific IgM and IgG antibodies, as well as viral RNA detection through PCR. 4. What is the recommended treatment for dengue? There is no specific antiviral treatment for dengue, and management focuses on supportive care, including hydration, pain relief, and fever control. 5. How can dengue be prevented? Dengue can be prevented through mosquito control measures, such as eliminating breeding sites, using mosquito nets and insect repellents, and wearing protective clothing. 6. What vaccines are available for dengue? There are currently licensed vaccines available for dengue, such as Dengvaxia, which is approved for use in some countries. 7. What are the primary strategies for controlling dengue outbreaks? The primary strategies for controlling dengue outbreaks are focused on vector control, including mosquito surveillance, larval control, and public health education. 8. Can dengue be sexually transmitted? There have been rare reports of sexual transmission of dengue, but it is primarily transmitted through mosquito bites. 9. Which mosquito species is responsible for dengue transmission? The primary mosquito species responsible for dengue transmission is Aedes aegypti, although Aedes albopictus can also transmit the virus. 10. What is the incubation period for dengue? The incubation period for dengue is usually 4 to 7 days, but it can range from 3 to 14 days. 11. Can dengue be transmitted from mother to child during pregnancy? Yes, dengue can be transmitted from a mother to her child during pregnancy, although it is relatively rare. 12. Is dengue a notifiable disease? Yes, dengue is a notifiable disease in many countries to facilitate public health monitoring and control efforts. 13. What is dengue hemorrhagic fever? Dengue hemorrhagic fever is a severe form of dengue characterized by bleeding tendencies, plasma leakage, and organ impairment. 14. How is dengue diagnosed during the acute phase? Dengue diagnosis during the acute phase is primarily based on clinical symptoms and the detection of viral RNA through PCR. 15. Does dengue have any long-term complications? Dengue can have long-term complications, such as fatigue, joint pain, and neurological consequences, including dengue encephalitis. 16. How effective are insecticide-treated bed nets in preventing dengue? Insecticide-treated bed nets can be effective in reducing dengue transmission by preventing mosquito bites during sleep. 17. Can dengue cause death? Yes, severe cases of dengue can lead to death, especially among individuals with weakened immune systems or pre-existing health conditions. 18. Can dengue be transmitted through blood transfusion? Yes, dengue can be transmitted through blood transfusion, although such cases are rare due to screening protocols. 19. What are the potential complications of dengue hemorrhagic fever? Potential complications of dengue hemorrhagic fever include shock, organ failure, and death if not promptly treated. 20. Are there any specific antiviral drugs available for dengue treatment? Currently, there are no specific antiviral drugs available for the treatment of dengue. Management is supportive. 21. Can dengue recur after initial infection? Yes, individuals can be reinfected with a different dengue serotype, leading to more severe disease known as dengue hemorrhagic fever. 22. Is dengue a reportable disease to the World Health Organization? Yes, dengue is a reportable disease to the World Health Organization, WHO, to track global dengue burden and facilitate international collaboration. 23. Are there any specific populations at higher risk of severe dengue? Children under the age of 15 and older adults are more likely to develop severe dengue than other age groups. 24. Can dengue be transmitted through breastfeeding? No, there is no evidence to suggest that dengue can be transmitted through breastfeeding. 25. How accurate are rapid diagnostic tests for dengue? Rapid diagnostic tests for dengue can be accurate but are often used as screening tools and may require confirmation through additional laboratory testing. 26. Can dengue be transmitted from person to person without mosquitoes? No, dengue cannot be transmitted directly from person to person without the involvement of mosquitoes. 27. Can dengue be prevented through vaccination alone? While vaccination provides important protection against dengue, integrated mosquito control measures are also essential for effective prevention. 28. Are there any specific risk factors for dengue transmission? The presence of Aedes mosquito vectors, high population density, and inadequate sanitation are risk factors for dengue transmission. 29. Can dengue be cured without any treatment? Most cases of dengue resolve on their own without specific treatment, but supportive care is necessary for managing symptoms and preventing complications. 30. Is dengue a globally distributed disease? Yes, dengue is a globally distributed disease, with outbreaks occurring in tropical and subtropical regions worldwide.